Hi everyone, and very good evening to all of you. Probably the day that you're waiting for, not in a good way, but yes, the NEET PG 2022, and the clinical questions as we expected was there, and most of you, as you are correctly saying, that the question was not very tough. That's very true, but the questions options were a bit tricky, as you expect from any competitive exam. I have tried to recollect the questions only with your effort and your help. I'm truly thankful to all my students who have been so much helpful every time. They give me questions within a fraction of few 2 to 3 hours, and really thank you to all of them again, who could help me to recollect all the questions. I could recall around 25 questions of pathology as of yet. I've tried to put the options correct, the questions correct, but because they are all recall based questions, so I would encourage all of you to please correct me if you find any mistakes. At the same time, let me know that what actually was going in your mind, and maybe we can sort it out for the future questions also. For those who are actually planning to appear for the next years of NEET PG or NICT, I'll also request you to see these questions just to understand the pattern of the questions, to maybe understand how would they have marked the options, because I've tried to also recall the questions here correctly along with all the options. So that is one very important other thing that you should be taking care of. Without wasting your time, I'll start with a single question. This is the first page of my genetics notes that is often I teach in my classes. So I'm very sure you might also mark this question correctly, and I will encourage that if you can please also tell what is your answer, and let's try to answer it from there also. So single nucleotide change resulting in a stop codon, what do you think it is? First of all, it's a very practically made question. SNP is any change in a DNA sequence, and because something is a stop codon, the answer should be obviously a nonsense mutation, is also called as termination. Okay, it is also referred to as termination mutation. Okay, so it is also called as termination codon, and we all know the termination codons are the 3U. Yes, as well, but I always talk about A, AG, okay, AG, laga. So UAA, UAG, and UGA. Okay, move to the next question. Yes, stop codon was definitely the question. Next question. This is a question which often I have discussed in my test and discussion, is thromboelastography. Now, this is not a new question. This question actually was asked in NICT 2 years back. So I'll just say this is a complete repeat question, nothing new about it. Stop codon, trauma patients was to undergo emergency laparotomy, and they wanted to monitor the correlation studies, which the following is the investigation of choice. So as you see, what happens in this test is, if you look at the graph here, what they do is they make a baseline graph like this. I'll make a baseline graph like this. So initially there is a primary wave, then there is a secondary wave, and finally when they put thrombolysis, the wave stops. So the three ways that the graph entirely takes into account. The first one is a primary wave that looks into platelet studies. The second one is the secondary coagulation step, that is the thrombus formation, and finally at the last point there is what is called as a fibrinolysis. Okay, the last one is actually a fibrinolysis. So this part here is a fibrinolysis. So what happens is, because you are able to look at all the three problems, that is the primary wave, secondary wave, and thrombolysis, then therefore it's called as thrombo. Okay, the name is thromboelastography. Okay, the name is thromboelastography. This is thromboelastography. Okay. The other options were quite different types, sonography, plethysmography, which obviously this is not the case. To look at correlation studies, you go to what is called as thromboelastography. Now this was a pretty good question. I would like to make you understand here what will increase our lifespan. Now the two questions on the topic of aging, one was a question which will increase our lifespan, and one of the question was which is not seen in a process called as aging. Now, for those who are my regular students, they'll always remember, when I take a first break in my cell engineering chapter, I talk about, now this is the best way to delay the aging process, and that is decreasing calorie intake. Now, there are two things that can decrease the calorie intake. One is decreasing calorie, and one more is this compound called as sirtuins. And you all remember sirtuin is activated by this unique substance that is called as, yes, it's red wine. Yeah. So what is red? Red wine is a substance which can actually also activate the activation of sirtuin. Now remember one thing, the calorie restriction is one thing which is a proven way. So regular exercise is definitely a good way, might be a good way in days to come, but right now what is proven way is a proven. The question was clearly asking you which is a proven way. The proven way is decreasing calorie intake by around 30%. So as you see, many of know that we often have weight loss. The weight loss is one of a very good way, and occasional fasting is also a very good way to decrease the calorie intake. Okay. Which of the following is the autosomal recessive inheritance? So what is your answer, guys? This is a very pretty straight away question, and the answer is yes, it is cystic fibrosis. Remember, Huntington disease, achondroplasia, these all are the autosomal dominant diseases. Okay, please remember, these all three, they are autosomal dominant diseases. Okay. One thing often asked to me, sir, how to remember these autosomal dominant, autosomal recessive? I always say one thing, one thing is that I always distribute some notes in my regular classes telling you that because these are the notes, and at least read these things at any time of your preparation. So I give you a notes of autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive, and I tell you, please एक बार इसको पढ़ लेना. Last time the question came was on Turner syndrome, this time on Klinefelter syndrome, and this time the question is actually on the autosomal recessive inheritance syndrome. So please go through that. Okay. For those who are asking, sir, where I get this PDF will be available in my Telegram group just after the completion of this session. Okay. So move to the next question. Yes, this again question. Everything is from the notes. So for someone who has actually attended my classes, they will actually be so much confident about it. What is nuclear? What is a neutrophil? Extra cellular traps. So NET is actually something in which I draw an image like this. Remember, this is a neutrophil. Okay. And if many bacteria, they attack to each other like this, it's a cocci, bacilli, everything. Neutrophil release every chromatin out. It will get lysed, release the fibrils out, and the fibril will destroy it because the fibrils have very high concentration of the antimicrobial enzymes. But surely what NET doesn't have is doesn't have a mitochondrial DNA. Okay, surely NET doesn't have a mitochondrial DNA, is no doubt about it. Now, one other thing that you should understand is, NET is seen in a bacterial infection. It can be seen in sepsis. It's activated by the platelet in the circulation, and the lysis occurs by this enzyme called as arginase. And the problem of the NET is that it's a type of society benefit, but the problem is it can also increase the risk of SLE. That can another be a question in the upcoming increases the risk of SLE. This can also be asked in the next coming questions. Okay. Now this was a question that has confused a lot of students. I'll just tell you why you got confused. It is a case of the hypochromic microcytic RBCs, and the RBC indices were set and the targets are there. Please remember, probably what you have not taken care of is this RBC count of 5.2 million. Now, if this would have been a case of iron deficiency anemia, try to always calculate a Menzer index. Sorry. So, guys, what is Menzer? Sorry. What is Menzer index? Menzer index is when you divide the MCV by the RBC count. The MCV by RBC count here was around less than 13, because it's less than 13 here because the RBC count is more. Therefore, the primary diagnosis you should make is of thalassemia minor. Okay. Now, why not iron deficiency anemia? Thalassemia minor, and why not iron deficiency anemia? Because had this been iron deficiency anemia, there should have been a very low RBC count also, and hence it cannot be a case of iron deficiency anemia. So yes, the fourth option was RW. I think the better way to look into this is to try to calculate the HbA2. If this is a case of thalassemia minor, remember thalassemia minor may the HbA value will decrease and the A2 value will increase. The HbF will remain normal, or is normal less than 1%, because this will prove it's a case of thalassemia minor. Okay. So one option was also homocysteine. Thank you, guys. So one option was also homocysteine. Someone was saying RW, but I will probably correct it and try to just make it correct here. The one of the option here was homocysteine. Okay. चलो next question चलते हैं. Okay, a 56-year-old male with a chief complaint of high TLC count, platelet count was high, there was high hemoglobin and dragging such an abdomen, and the peripheral smear shows a lot of myelocytes, metamyelocytes. There was also a massive splenomegaly here. Okay, massive splenomegaly here. So this is surely a case of chronic myeloid leukemia, and a CML shows often a translocation of 922, which you all know this is a case of a PH chromosome. Yes, it's a case of a PH chromosome. There's no doubt about it. Why? Because this becomes a case of CML, and we all are aware that CML, it shows what is called as a PH chromosome. Okay, this pen is really creating a problem for me. Anyway, this is a case of PH chromosome, and therefore translocation 922 is the right answer. Now, I hope you all remember. Okay, one option was 822. Thank you guys. 822 was one other option. One more thing you should understand is that this is actually called as garden party appearance, and garden party appearance can show you myelocytes, metamyelocytes, eosinophils, basophils, and all the cells are actually seen in a garden party appearance in a case of CML. Now, this question, some of you, I think a lot of you might have marked this question correctly by executing the options. There was a cystoscopy done and was showing you multiple yellow-white. Now, this is a very interesting line written here. Yellow-white plaques in the bladder, and histopathology shows the infiltration lamina propria. And look at these black bodies. These black bodies. Okay, please can you see these black bodies. So these black bodies are called as Michaelis-Guttman body. They're called as the Michaelis. Okay, they're called as the Michaelis-Guttman body. Now, because they're called as Michaelis-Guttman body, it is seen in a case of what is called as a malakoplakia. Okay, it is seen in a case of malakoplakia. Okay, and malakoplakia actually it is often due to a chronic inflammation of the bladder, and often the etiology seen here is a proteus infection. It can also be Escherichia coli. Usually, it is not caused by tuberculosis because tuberculosis will cause you a granuloma formation. So malakoplakia, what is it? It's a chronic inflammation of the bladder in which the macrophages, they engulf those cells, and afterward they have a calcium deposition inside it. The calcium deposition looks at this blackish color deposition, which, as I told you, it is called as Michaelis-Guttman body. Okay, they're called as Michaelis-Guttman bodies. Okay, this was again a pretty simple question. For those who are getting correctly, I think that is mostly because you have attended the class and you have revised the notes, and you see the question were quite simple. I'll not say very simple, but the question was simple, and those who have read from my notes, they have revised it again and again, they'll not make it wrong. And the PDF I shared, 100% strike rate from the entire 200 questions. What more than you would require for that? A mid-aged male with a painless, slow-growing neck swelling, lymph node was there, and surgery was done with a biopsy picture was given. Now, what is this showing you? It's clearly showing you this orphan ani nuclei. Okay, this is clearly showing you what is called as an orphan ani nuclei. Okay, it is an orphan ani nuclei, and because of orphan ani nuclei, these all nuclei you see here, I also show the images of this orphan ani girl there, and this is seen in a case of papillary carcinoma. Okay, it is seen in a case of papillary carcinoma. Because it's a case of papillary carcinoma, if you look at the options here, FNAC is not diagnostic. That is not true, because FNAC is not only diagnostic, FNAC here is confirmatory, right? And why it is confirmatory? Because FNAC shows this typical cell in the lymph node, in the biopsy. This is a pseudo inclusion because the cytoplasm invaginates into the nucleus and showing that white appearance called as orphan ani-nucleus. Surely the nuclear feature is characteristic of the tumor and spreads to lymphatic spread. Remember, all thyroid carcinoma go by lymphatic spread except follicular carcinoma, because follicular carcinoma goes by the hematogenous spread. And surely it has excellent prognosis, because once you remove the tumor, it often doesn't recur there. Okay, so surely the question is FNAC is not diagnostic, because FNAC surely is diagnostics. Okay, FNAC surely is diagnostic of this condition. Guys, how are you feeling? What is your feeling of the exam? Are you having that confidence? Yes, I will do well, because that is what I require from you all. Whatever happens, happens. But right now, on the day of the exam, you should feel that confidence. Okay, sir, I have done my good. Let's see what happens in the days to come, right? So please have that confidence. Surely you'll do well, because I know you all are so much crazy about getting a good rank in NEET PG. Okay. Acha, ye dekho, this is a question. I don't have the exact question because you don't require the question. Okay. Now this was a case of an image-based question giving you there is something called as yes, it is what? It's a islet cells of Langerhans. Very good. It's a islet cell Langerhans. This is the exact image I also uploaded in the YouTube video. It's islet cell of Langerhans. Sorry. It's a case of islet cells of Langerhans. I hope you have watched the video. If not, please go through the this channel and try to first of all subscribe the channel. That's very, very important because I'll put a lot of things in the upcoming days, the motivation videos, how to revise, how to start again, how to enjoy the most, right? And NEET PG is over, and what you must do is try to enjoy the most in the next upcoming days. Okay. So this is what RF cell of Langerhans is, and they are lightly pink in color as corresponding to other areas. These all cells are the this is an endocrine area, right? It's an endocrine area. Okay, this is the endocrine area, and these all are the exocrine area. Okay, this is the endocrine, and this is the exocrine area of the gland from which all the secretions come out into the outside of the pancreas. So next question, a 27-year-old male with a road traffic accident after 2 days developed dyspnea, petechial rash and unconsciousness. So this is a typical case where after a severe trauma the patient has suddenly collapsed, and this is a case of what? It's a fat and marrow embolism. Now how do I tell you this? In embolism you have to remember only two things. I hope you all remember this. Kahan se aaya hai, kahan ko jayega. This is a very common thing I tell you in the classes. Kahan se aaya hai, kahan se jayega. Matlab most commonly spermoembolism, kahan se aaya hai, DVT, kahan ko jayega. From it has come from the deep vein trauma of the legs, kahan ko jayega, in the pulmonary arteries. Similarly, I talk about the systemic thromboembolism, the air embolism, the fat embolism, and not to forget the amniotic fluid embolism. Surely this is a case of fat embolism. Okay. Next question, chalo. A 10-year-old male presents with edema and asarca, and what is diagnosis of the minimal change disease was made. Now about the minimal change disease, what is true? Now this was a slightly confusing question for some of the students, but I'll tell you, this is a minimal change disease. Once you have diagnosed a case of minimal change disease, it is surely respond well to the steroid. That's very, very true statement. Now the light microscope doesn't show this. Sorry, the light microscope doesn't show this. It is shown by the electron microscopy. Now this is very, very important information that you should all be having. Okay, it is electron microscopy. Sorry, this is electron microscopy which shows. It's an electron microscopy which shows the effacement of the podocytes. It is seen not in adults but is seen in children. So this cannot be the answer here again. Okay, it is seen in children. So that is one thing that we studied, and it often shows selected proteinuria, not the non-selected proteinuria. So the age was 25 years, some saying 20 years. Okay, I'll just take it both as the right question. It might be 20 years, might be 25 years, but whatever it is, the answer is still the same. It must be a case of minimal change disease. Okay, might be 20 or might be 25. Okay, chalo, next question. Warburg effect. Now this is again a confusing statement for some of you. See, Warburg effect kya hota hai? Warburg effect is something when a tumor cells take more of the glucose and convert to the lactic acid, even presence or absence of oxygen. Now that lactic acid again converted to make the glucose, lipids and the nucleotides to make more and more tumor cells. That means they are making the elements required for cellular metabolism. Remember, it is not reduced, it is increased. It is not for ATP. There is no requirement of ATP. They are at least not. Yes, they don't prevent apoptosis. That's also is a wrong statement. But surely what is true is they provide the elements for cellular metabolism. No doubt about this. Okay, there should be no doubt about this. Okay, there was a question on tumor lysis syndrome, guys. I think yes, I have missed this question. So any of you, can you please tell me what was the exact question on tumor lysis? What was the question on tumor lysis syndrome? Can you please help me, guys? Question on tumor lysis syndrome. What was that? Please let me know. Okay. Now this is again a confusing question to some of you. Now this was a question in which the 30-year-old male with having a child of infertility, similar analysis shows azoospermia and diagnosis was done. Now I hope you are all attending Vibe session, because in Vibe I give you an image of testicular atrophy. Now, this is an image I often give to you in the vibe. Even though this is not a case of testicular atrophy, because in testicular atrophy, what you must see is the basement membrane thickening and fibrosis, okay? And there should be a slight amount of the Leydig cell also being seen here. Right now, in this question, the case is of infertility and the semen analysis show azoospermia, and you see there's no cell here. There's no cell here because there's no cell here. It's completely absent. You know what is this? This is a seminiferous tubules. Sorry. Okay. Now this part is a seminiferous tubule. Okay. This is seminiferous tubule, and you know here is where you find two Leydig cells. But right now you are not able to see the Leydig cells, and therefore the answer must be Sertoli cell only tumor. Now, had this been a case of orchitis, you might have seen a lot of neutrophils, which you are not seeing here. Had this been a case of testicular atrophy, in testicular atrophy, these base membrane, so you see base membrane, that should be very, very thick. It is not showing a very thicker base membrane, and you're not seeing any Leydig cell, and hence this should be a case of Sertoli cell only tumor. Okay, Sertoli cell only tumor. Okay, there's also an option of seminal tumor. That's what I'm saying. I've written it there in the last option C. It is a case of, the fourth option is non-seminal germ cell tumor. Okay. There's no question on tumor lysis syndrome. Better, this create confusion. Okay, some of you saying there was a lymphoblast slide. Was there any question on lymphoblast, beta? Was there any question on lymphoblast? Please let me know. Okay, this question: a 12-year-old male with a case of bloating, steatorrhea, and HLA DQ2. Oh, sorry, it was actually 2. And also, what you can say is it can also have HLA DQ2. They may have also HLA DQ8 and HLA DQB8. Okay, DQ8 is there, and they can also be B8. Even though in this question the option was only about the in this question the option was only about the DQ2, and because it was HLA DQ2, it can also be DQ8 and can be B8. It should be a case of celiac disease. Now, because it looks to be a celiac disease, because this looks to be a case of celiac disease, okay, therefore I think it is very clearly understood it should be a low gluten diet. Okay, low gluten diet. Okay, so MHC2 was there. Yes, a gluten free diet should be given. Lymphoblast was in peripheral smear. Kiska kaun sa question? Was it a different question? So look at the question again, and let me again come back to that. Question number 17. A 40-year-old patient who was having arthralgia, oral ulcer, and joint pain. Now this is strictly a case of SLE, and I hope you remember SLE kana. I give you a mnemonic. Yes, what is it? It is brain. Okay, and then MD. So SOAP brain MD. SOAP brain MD is a typical a mnemonic of SLE, and they have oliguria and hematuria RBC cast. Sure, it becomes a case of lupus nephritis. Okay, lupus nephritis. Even though this was a very long question, the gist of the question was given to me by the students, but yes, it can be there. Okay, one was a question: lymphoblast with hyperuricemia, low urine output, best management, probenecid, hydration, urgent chemotherapy. Okay, I think this was a case. This was a question in which we were talking about, the tumor lysis syndrome. See, the tumor lysis syndrome, the first thing you do is you give hydration, but that is only to prevent it. If you want to cure it, then you have to remove all the uric acid out of the body, and that is how you cure that case. Okay. Chalo. Raised LDH, elevated bilirubin, hemoglobinuria, and peripheral smear showing cystocytes. So what is this showing you? It is showing you a case of microangiopathic hemolytic anemia. Now, even those students would have guessed it from the choices as well. But this was a very well-made question, and they were trying to ask you whether you know that there occurs a microangiopathic hemolytic anemia in a case of the prosthetic heart valve or not. And hence the answer surely is a mechanical second heart sound. Okay, mechanical second heart sound. So that was surely a case. What must be here? It should be a mechanical scenario, because it is surely not seen with goiter. Splenomegaly is not seen in a case of intravascular hemolysis. You never see splenomegaly, and there is no question that there should be any raised amount of HbA2 seen there. So surely the answer should be a mechanical second heart sound. And why? The reason of this could be found as a prosthetic. Should be found as a prosthetic heart valve. It should be due to a prosthetic heart valve. Okay, that should be the reason why it is being caused here. Okay. Chalo, can we move to the next question, guys? Right now, this was a straight simple question. It was a 40-year-old pattern hemorrhoids. Hemoglobin was low. What is the PS morphology? I think this was a simple question here, and I have not got the other options here. But I think what they were trying to ask you here, they're trying to ask you whether you know that if it's a case of iron deficiency anemia, it looks to be a case of iron deficiency anemia. It'll show you a microcytic hypertrophic blood picture. It's a straight away question, and there's no thing seen there. Okay, so option C was heme in the stool. So next question, ulcer nodule on the tip of the nose measuring 0.7 centimeter. And this was the image given here. And if you see this area here is showing you a palisading. Okay, it is showing you a palisading here. Even though some of the other images can show you a case of, I tell you three things in my Vibe images. I show you only three type images. I show you squamous cell carcinoma in the Vibe sessions. I show you squamous cell carcinoma, I show you basal cell carcinoma, and I show you malignant melanoma. Only three images show you, and that is what is always asked. Okay, so I don't know, but that is how I feel lucky, and my students will also feel lucky, because this is surely a case of basal cell carcinoma. What is the answer here? Had this been a case of melanoma, you would have seen a lot of melanin pigments. A squamous cell carcinoma would have shown you a keratin pearls, and yes, a nevus might have shown you the hyperpigmentation and the melanocytes deposition in the basement layer, that is so the stratum basale of the skin layer. Okay. So next question. Middle-aged women who died of COVID-19 infection, she was on a ventilator. Now, what do you find in the alveoli? Now, this is surely a case of ARDS. Again, straight away taken from my notes. I should not say this, but yes, a lot of students will always find this a case of ARDS, and the finding on ARDS will be a thick fibrin lining the alveoli. Remember, it is this second image shows you a finding of any inclusion body, which can be, remember, the COVID-19 does not show any inclusion. Remember, this is the inclusion body. Inclusion body can be seen in measles. It can be seen in the other viral infection also. But this is looking like a case of COVID-19 infection. And the answer must be a fibrin deposition. It's seen in a case of ARDS. It will not show you the case of acute and the chronic hemorrhages. Okay, acute and the chronic hemorrhages. Okay, the some of the huge saying that this was 0.3 centimeter. So maybe we can check it again. But whatever it is surely a case of basal cell carcinoma. Okay, look at this question. Now, I have been told so much time by students, sir, please, the option here was not HV16. I completely agree. The option was not human papilloma 16, but it is a case of multiple vaginocervical warts in a patient, and she was shown to be a risk of HPV by DNA analysis. And now, when she has a maximum risk of HPV, what is the strain that it can be shown? So, what is your answer, guys? What have you marked here? Batao. What have you marked in this question? You must have marked, yes, 18. Remember, 16 and 18 are the two right answer here, because 16 is not in the option. So 16 and 18 are the high risk HPV. Because it is not in the option, I think we can all go with the 18. Okay. In ARDS, it is not eosinophilia, right? Remember, ARDS has neutropenia and not eosinophilia. Okay. Yes, 18 is the right answer. Okay. चलो अगला क्वेश्चन चलते हैं. Again, I repeat, the PDF of this will be available in my Telegram group after the session. You can download it from there and try to use it for revision purpose in the next upcoming exams. Okay. A 6-year-old male in extremity, she was admitted with a history of chest infection 2 years back. HbA1c shows increased HbF and HbS. So this is surely a case of sickle cell anemia. There's no doubt about it. And the two things given here. First of all, there's a pain extremities showing you something called as hand-foot syndrome. Okay. It's showing you the hand-foot syndrome. And secondly, with a chest infection, the pulmonary infection called as acute chest syndrome, it matches with what is called as a sickle cell anemia. Okay, sickle cell anemia. Even though I'm looking at all your suggestions here, like question number 19, the clumping of RBC was also there. I'll just check it again. And carcinoma means 11. No, sir. No, beta. देखो 16, 18 are the high risk HPV. Please understand this. And other 32, 33, 31 and 33, these are the low risk HPV. Please remember this. Okay. Now you're saying in this question, HbA2 was there instead of HbS. Okay, this was HbA2. No, probably beta, HbA2 was another question. I think you must also have got confused there. Probably this was one other question. Please look at this. You're saying it's not HbS. HbA2 was there. Even though HbA2 should also be increased in a case of sickle cell anemia, HbS was not there. Okay, okay, I agreed. So HbA2 was there, HbS was not there. So I completely agree to your suggestions. It was not HbS. Some of you saying it should be a case of, still it should be a case of sickle cell anemia, because it's showing you two things. Number one, hand-foot syndrome and the acute chest syndrome. Both of them are quite suggestive of sickle cell anemia. Okay, I completely agree with you. A blood transfusion was there. Okay, good. There's also a history of blood transfusion. Okay, there was also a history of blood transfusion. Let me just add that. There was a history, sorry. There was a history of blood transfusion. Thank you, guys. History of blood transfusion was also there. Agreed. Okay. S peak was high, was it? Okay, S peak was high. Good. So S peak was high. That's a very important history you have given me. So as this is going to be a question by the S peak was high. S peak was high. I think that is quite suggestive of sickle anemia only. And there was a mention of squamous cell carcinoma highest in. They mentioned the risk of squamous cell carcinoma and highest in. Okay, is that so? I need some or more of you to please tell me that. Okay, HbA2 was less and the S window has a S peak. Okay, agreed. Chalo, thank you. Still, the answer surely is sickle cell anemia. It cannot be beta thalassemia because of two reasons. Chest infection and pain extremities is not a feature of thalassemia. It should be a feature of sickle cell anemia only. I'm not saying it was hand-foot written there, but look at the pain extremities. This is called as hand-foot syndrome. Okay, this is called as hand-foot syndrome. I'm not saying hand-foot syndrome was there in the question. I am saying this is sensitive of hand-foot syndrome. Okay, chalo. This was a peripheral smear of sickle cell and the patient has a knee pain. They had swelling also. There was a lytic lesions and sclerotic borders along the radiolucent areas, and the fluid aspirate was a infection. So this is a typical case of the osteomyelitis in a case of sickle cell anemia. Okay, this is a typical case of osteomyelitis in a case of sickle cell anemia, and is caused by a Salmonella typhi. Okay, this is a case of Salmonella typhi in the question. Okay, I'm not saying it was hand-foot syndrome written there, but surely there was a pain in extremities as mentioned by most of the students there. So I believe that please we can maybe we can have that discussion. So would you like to, okay, let's come back to the previous question. Now, so I'm saying that there is pain in extremities was not there, agreed. Okay, there was a history of blood transfusion, agreed. Now, was there S peak or not? Tell me, was there S peak written or not? Was this there or it was not there? Because if there was S peak written there, it surely becomes a case of sickle cell anemia. If it was not a case of S peak, it doesn't become a case of sickle cell anemia. Now, tell me, was that written there or not? So you're saying this was not in the question. Okay, chalo, agreed. So you're saying, so this was not in the question. So I was cutting this here. Okay, now tell me. There was S peak was there. If you're saying S peak, there's no doubt, nah, that case becomes a case of sickle anemia. Okay, chalo, okay. If you're saying it was a S peak, then it is surely a case of sickle anemia. There's no, there is no doubt about that then. Okay. In beta thalassemia, infection can occur. Why will infection occur in thalassemia? Tell me one thing. What is the cause of infection in a case of thalassemia? Why? Chalo, next question. So this is a case of sickle anemia, and this answer is sorry, Salmonella typhi was also a question that we always teach in our question. But this is a case of dry cough and this bilateral hilar lymphadenopathy. It becomes a case of the sarcoidosis. It becomes a case of sarcoidosis. So guys, I believe we can have a discussion on some of the questions surely, but overtly, the question was not very out of the box. And if you can just turn the pages of my notes, I can, you can see those. It's all written in my notes simply. Sickle cell question written in the notes. This is a sickle cell question in the notes. Now, this is again in the vibe. I always talk about the high risk HPV and the low risk HPV. It's a vibe image. This is again a question of ARDS from the lung pathology. Look at this question, a vibe image of basal cell carcinoma. This is surely a simple case. No one had made this question wrong. This is again same thing. SCD lupus nephritis again is a topic that we always teach in the renal cell, in the renal case. This is a celiac disease. We talk about this in the in a case of GIT. In GIT, I take only few things, and those things always work. I talk about the colonic polyps, I talk about the malabsorption syndrome, I Hirschsprung disease, and they always work. It has never failed. Inflammatory bowel disease, I always talk about this. Okay. This is a case of infertility. Now, this is, I believe that some of you are still confusing this, because you saying that there is a lot of patient membrane thickening was there and was also fibrosis. So if there was a patient membrane thickening and fibrosis, then it could be a case of testicular atrophy. But because most of the students have agreed with this image, I will go with this only right now. But I'm very open to your discussion only. It should be a case of cellular cell tumor. Other options, this is a verbal preceded by question. You can find this in my notes of the neoplasia, a straight line right in there. Miller cell disease, again a straight notes question. Fat embolism on hemodynamics का simple question है ये. This is a image based session I took a few days back in the pancreas histology in the YouTube session of DBMCI, and this is a very this is a vibe image. It's a practical question. So many things we have discussed about this. This is a malakoplakia, and I understand this would have not been taught by me. I completely agree with this, and maybe you are excluded the option by looking at the white yellowish black plaque on the question. This is a simple case. I think all have made this correct only. It's a case of C7 and TH chromosome. Now this is a case of thalassemia minor, and therefore it should be a case of HPA2 being tried to measure for looking it out. Net is the simple diagram I always draw in a case of inflammation chapter. Autoimmune inheritance, the notes question, lifespan, and there's two questions. One was on the lifespan, one was on the telomere also. And this is a thermometry from my TND questions, and this is the first page of the question that we always take in the case of genetics chapter. Okay, so guys, I'm not saying that question was very easy, but yes, if you please try to trust the notes, try to revise the notes again and again. Right now, don't think about anything else. Try to just relax your mind, make yourself cool, and tell yourself that you have really performed good, and maybe you'll get a result that you all deserve there. Okay. The basic idea of recorrecting a question and recalling this on the same day is that we get to know where we're doing wrong, if at all, and at the same time, if I perform well, it is your day. Go out, enjoy, have fun, chill, and please let me know how you were impacted by my notes or the sessions that we always take, the motivation sessions, the challenging sessions, how to plan your days ahead, 100-day schedule, 60-day schedule, 25-day schedule, 7-day schedule, and the day before the exam. Always do it for you. Let me know in the comment below how much you are benefited by my sessions. Maybe I'll do it more further for your juniors, because you will get a rank and get into MD seat. But I'll do it surely for your juniors. Wishing you all the best. Take care. God bless you all. And I'll take it from here to the next faculty who will take their own chapters. But 25 question pathology really is a good number. 33 question from NICT and 25 question pathology. You should read this subject very, very well. Take care. God bless you all and stay happy. Okay, please, you can look into this. I've always put this Telegram logo. You can join the Telegram thing, and please join the Telegram group where you can find the PDF of this session as soon as the session ends there. Take care. God bless you all. Goodbye. Take care. Bye bye.